Good afternoon, one and all. I welcome you all to World GNMD celebrations on occasion of 88th birth anniversary of Dr. Hammer. First of all, let me introduce myself. I am Dr. Shavali Venkateshwarlu from Varangal, Telangana. I hold a bachelor's degree in homeopathic medicine and surgery at Bhopal from Barkatullah University. Presently, I am working as an assistant doctor at Dr. V.S. Reddy Homeopathic Center, Varangal. I was introduced to GNM by my guru, mentor, Dr. V. Reddy sir, and I'm practicing GNM in treatment for since 3 years. By the inspiration of great people, father of homeopathy, Dr. Christian Frederick Samuel Hahnemann, Dr. V. C. J. Verghese sir, Caroline Marcolin, Dr. V. S. Reddy sir. Let me start by giving the brief introduction about my research subject death flight conflict cases during so-called COVID-19 pandemic situation. Since it is explored by Dr. V.S. Reddy sir, and he has treated more than 2000 live COVID-19 cases with a great courage on the basis of GNM therapy. Particularly, why did I choose death flight conflict? As you are aware of deadly pandemic COVID-19 situation, what happened to the world in 2020? Why people are confined to home? Why people didn't attend their funeral, their friends or relatives' funerals even? Why people became so frightened, afraid, and selfish, isolated from the rest of the world? Even the God separated from their own children, parents, life partners during the virus spread. All the practitioners and doctors were alarmed that many have been tested positive. Many doctors have expired due to the COVID pandemic situation. Most of the doctors feared to treat the patients because of the scare that was created. Doctors cannot examine their patients because they themselves and their clients are following the COVID restrictions and measures with fear. Coming to Dr. V.S. Reddy sir, homeopathy clinic. Sir is from Varangal, Telangana. He is practicing homeopathy for 30 years. Sir is a GNM practitioner and he is interested in organic farming and cultivates on about 60 acres of agricultural land. The general OP has above 100 patients every day. Despite the deadly condition and situations that prevailed during the lockdown, when even a single person was not allowed to come outside and everyone locked themselves up in their homes, avoiding everyone, not allowing anybody to come near them. Dr. V.S. Reddy's homeopathy clinic were never remained closed even during the first lockdown itself. Dr. V.S. Reddy treated thousands of COVID people without wearing masks and never used sanitizers, PPE kits, gloves, etc., without taking any precautionary measures. He appealed to health organizations, government agencies, and WHO to conduct studies on his practice, family, staff, and clinic. He said that this kind of practice and confidence that he nurtured during that long tenure of experience and because of GNM India movement, Dr. Hammer, Caroline Marklin, Dr. Praful Vijay Dr. C.J. Burgi sir. Dr. V.S. Reddy sir is follower of GNM. He emphasized that COVID virus is not a nightmare and instead it is a goddess based on Dr. Hammer's fourth biological law. Only the GNM followers in the world enjoyed the real freedom from the scare of diseases, including viral diseases in the name of epidemics or pandemics. Right knowledge liberates us with this freedom, and he further says that his family enjoys freedom because they know GNM. There are about 2,600 members of GNM India movement who learned this right knowledge. Their families are also being protected under the wisdom of GNM knowledge. At the time when the whole world is looking through the PPE kits through only screens with a complete isolation from the world and locked themselves in the suffocating PPE kits. Dr. V.S. Reddy, sir, follower of the Dr. Hammer, cured thousands of COVID patients with homeopathic medicine based on the GNM theory. Dr. V.S. Reddy, sir, is a nature lover. He says in India, traditionally chickenpox is called as goddess and people just worship the person who is affected with the chickenpox virus. He never isolated, ignored, or maintained social distance from the people. He instilled confidence in the patients' minds and went on explaining to them how the virus can be tackled and never threatened his patients. He sat beside the patient with great courage and brave, freed them out of the deadly situation by allowing COVID patients into his counseling chamber. He allowed them to cough and sneeze freely without any fear and using masks. He also used to eat food without washing hands after hugging the COVID patients just to give the confidence to the people. He gave assurance that virus cannot kill them until they remain confident during the treatment. It is only fear that was causing numerous deaths at the time. Since Dr. V.S. Reddy sir is a nature lover and spends his leisure time on his farms, he gives an example from the cattle Goshala. If a cow is isolated from the cattle, it suffers loneliness, starts thinking that it is no longer normal, it affects its brain and starts losing interest in its life and succumbs to death very soon. It also stops its nature course due to this isolation from its natural life order. Sir has deep observation on the nature. He said isolation is making people die. In GNM terms, that is separation from the pack due to the death fright. As per Dr. Hammer's statement, the differentiation between the psyche, brain, and the body is purely academic. In reality, they are one. Microbes do not cause diseases, instead plays a vital role during the healing phase. Diseases are never contagious. On this basis, Dr. V.S. Reddy has saved thousands of patients' lives and now remained as God for all the survivors of the COVID patients. Sir, with wholehearted soul, have touched and helped the whole COVID patients and treated them on the basis of German new medicine theory, making everyone that in the state surprised and shocking, like how this doctor is being courageous, free, fear free to touch and see the treated deadly virus affected patients. Sir's treatment of COVID patients is based on Dr. Hammer's theory that the virus doesn't kill people. He got viral in news over the state and there were a huge crowd in front of the clinic for getting treatment. Conventional doctors complained against Dr. V.S. Reddy sir for not using masks, not maintaining social distance, and allowing the gathering of thousands of people at his clinic for their treatment.
కరోనా వైరస్ బారిన పడి చాలా మంది ప్రాణాలు కోల్పోతున్నారు. కరోనాకు మందు లేదని ప్రపంచ ఆరోగ్య సంస్థ, వైద్యులు హెచ్చరిస్తున్నారు. సాధారణ జలుబు, జ్వరానికి వాడే మందులే వాడాలంటూ సలహా ఇస్తున్నారు. అయితే వరంగల్ జిల్లాకు చెందిన హోమియో వైద్యులు విఎస్ రెడ్డి ఈ వైరస్ కి తన దగ్గర మందుంది అంటున్నారు. వరంగల్ జిల్లాలో విఎస్ రెడ్డికి హోమియోపతి వైద్యునిగా మంచి పేరు ఉంది. హోమియో వైద్యంతో 21 ఏళ్లుగా ఆయన ఆసుపత్రి సేవలు అందిస్తోంది.
దాని ఎంబ్రియాలజీ తీరుపైన డాక్టర్ హ్యామర్ అతన్ని ఇన్వెస్ట్ చేసి ప్రతి రోగం కూడా బయాలజికల్ ప్రోగ్రామే, క్యాన్సర్ కూడా బయాలజికల్ ప్రోగ్రామే, మీరు రోగం కింద ట్రీట్ చేయకండి అని చెప్పి ఒక మంచి మహాగ్రంథాన్ని రాసి ఈ సమాజానికి అద్భుతంగా అందించి రీసెంట్గా అతను 2000
The government health officials seized the clinic for a week and planned to file a case on a non-bailable Magic Act, but the government and conventional doctors didn't succeed. That didn't last longer. Within a week, with the support of public, served patients protested and social media on behalf of Dr. V.S. Reddy, the government has took a back step and reopened the clinic. And Dr. V.S. Reddy sir continued his treatment in the clinic and visited the homes of COVID patients. Even today, he treats patients based on the GNM therapy and prescribes his medicine and brings awareness to many patients from different states and many countries with the GNM knowledge and making them live spiritually in the line of Dr. Hammer to lead a fearless life. We would like to share our clinical experience before presenting the case. According to GNM therapy application and treatment of so-called COVID-19 cases, Sir has never allowed isolation of the patients from their family members. This is our clinic during the so-called COVID-19 pandemic situation. The example of one of the patient.
ఇప్పుడు మంచితో మంది చేశాను ఎన్ని సంబంధించి మీరు
5 to 10 minutes లో
5 to 10 minutes మీరు రికవర్ అయ్యారు యూఆర్ హ్యాపీ
హ్యాపీ.
మంచి రాండి నా వాకింగ్ చేద్దానండి వాకింగ్ చేద్దాను
నడుద్దామంటే భయం అయ్యేది. ఎందుకు పడిపోతాం విన్నామన్నా పక్కన సపోర్ట్ తీసుకొని పోవాల్సి వస్తుంది. సపోర్ట్ కండిషన్ హైదరాబాద్ షిఫ్ట్ చేద్దాం సార్ అన్ని హైదరాబాద్ షిఫ్ట్ హైదరాబాద్ వెళ్ళిపోదాం అనుకున్నాం. ఆక్సిజన్ పెట్టుకున్నారు. ఆక్సిజన్ లేకుండా హ్యాపీగా ఉన్నారు. సో హ్యాపీ కంఫర్ట్ ఆల్ ది బెస్ట్. ఎవరు ముట్టుకోరు కదా. రైట్ చాలా ధైర్యంగా ఉండండి. ఎవరు రాలేదు ఓకేనా.
What is a psych? That is mind. Thought source is from visual and auditory senses. In the forest, a boy is playing with a wild animal, carnivorous, and a domestic animal, herbivorous. The boy is free from fearful thoughts and playing as usual with equal happiness without any flight and fright response, enjoying without any prejudice. Here, the person has collective information in his subconscious mind and consciously responds his survival. One is escaping from the carnivorous animals, and other person is hunting herbivorous animals. The boy plays with the wild animals because he doesn't have prior information about the animals, and he is when he puts on age he will know the information from the grandmothers, teachers, parents, books, television, and through the five senses, particularly visual, auditory. Such information is received through our amygdala and stored in the hippocampus, together constituting the limbic system. With the help of Dr. Hammer theory of German New Medicine about the psyche, brain, and organ relation, the boy with the wild animals because he doesn't have prior information about the animals. Of course, if you do come face to face with a hungry tiger, there's just one thing you should do: run. Environmental influences. The role of environmental influences in the etiology of anxiety is well established. Early adverse experience is a major developmental risk factor for the psychopathology. The fact that emotions are intimately linked with organic life, three fundamental aspects of emotions, feelings, or mental states: the mental or psychological level, the neurophysiological level, and the behavior level. These three complementary aspects are present in even the most basic emotions, such as fear. Stimuli from the environment activates the thalamus, which relays the information to cortex and viscera, and back again to the cortex to generate the emotional state. According to the behaviorism, the three types of unlearned emotional responses, which are called as fear, rage, and love. This woman we met said in her words, I don't feel anything about my throat and never shown it to any doctor, never got any treatment since 40 years and just left it. Despite the growing literature and education, people are still trying to live in a state of extreme cleanliness. They are making many efforts to make their surroundings germ free. People who have a natural way of living are not afraid of illness or microorganisms. Rather, they continue their daily activities and do not pay any attention to the health condition. This automatically causes their conflict and body enters into the healing phase. The German New Medicine is a boon to overcome many conflicts and live with a fear free mind. The connections between the cerebral hemispheres and the hypothalamus and between the cerebral hemispheres and the dorsal thalamus mediate the emotions. Expression depends on the hypothalamus and experience depends on the cortex. The biology of fear and anxiety. What is the difference between fear and anxiety? The main function of the fear and anxiety is to act as a signal of danger, threat, and motivational conflict, and together it triggers appropriate adaptive responses. Fear is a motivational state aroused by specific stimuli that gives rise to the defensive behavior or escape. Anxiety is a generalized response to unknown threat or internal conflict, whereas fear is focused on known external danger. Defense and coping strategies. Fear or anxiety results in hypertension tachycardia in the fight or flight response. When threat is inescapable and are usually characterized with autonomic inhibition, hypotension, bradycardia, and more pronounced increase in the neuroendocrine response, activation of the hypothalamic pituitary adrenal axis, and increased glucocorticoid secretion, flight responses to threats cause the freezing. Fear causes fear of death. Dirk Hammer syndrome might be a shock. Sadness from the deaths of own family members, relatives, neighbors, and friends causing the death fright conflict. As per the information about the amygdala and hippocampus, now we are coming to our agenda topic so called COVID-19. We received a lot of information through TV, media, ringtone, government alert informations continuously passing messages to the public. We received it through our visual and auditory senses through the amygdala and stored in the hippocampus and registered in the subconscious mind level. The news that oxygen is not available, the virus is spreading enormously. Brain level circuit we observed in our clinic. What happens when you are scared? Have you ever wondered why being scared makes your heart beat faster and makes you breathe quicker? The fight or flight response is the body's reaction to fear, and people have had it since the beginning of the time. To prepare for the fight or flight, your body does a number of things automatically, so it's ready for the quick action or quick escape in the danger. Your heart rate increases to pump more blood to your muscles and brain. Your lungs take in air faster to supply your body with oxygen. Your pupils in the eyes get larger to see well, and your digestive and urinary system slows down for a moment so you can concentrate on more important things. The fear reaction starts in the brain and spreads through the body to make some adjustments for the best defense for the flight action. The fear response starts in region of the brain called as amygdala. Amygdala is an almond-shaped set of nuclei that is situated in the temporal lobe of the brain. For example, amygdala activates whenever we see a human face with an emotion. Amygdala can activate the person's fight or flight response as a reaction to the real or perceived threat of danger. Amygdala hijack describes the perhaps unnecessary triggering of the response and actions that follow it. This reaction is more pronounced with anger and fear. A threat stimulus such as sight of the predator triggers a fear response in amygdala which activates areas involved for the preparation of motor functions involved in the flight or flight response. It also triggers the release of stress hormones and sympathetic nervous system. A part of the brain, also called as hippocampus, functions involves human learning and memory. It is a part of limbic system in which functions of feelings and reacting occur. Amygdala is specialized for input and processing of the emotion, while hippocampus is essential for declarative or episodic memory. Declarative memories are those related to the facts and events. During emotional reactions, these two brain regions, amygdala and hippocampus, interact to translate the emotion into the particular outcomes. Hippocampus is closely connected with amygdala, and hippocampus prefrontal cortex helps the brain to interpret the perceived threat. They are involved in fight or flight response. Passive coping strategies such as immobilization or freezing are usually excited when a threat is inescapable and are usually characterized by autonomic inhibition, hypotension, bradycardia, and a more pronounced increase in neuroendocrine response. Activation of the hypothalamic pituitary adrenal axis, increased glucocorticoid situations. Threat perception, emotion and risk perception. prejudice and discrimination, disaster and panic situation. Everything is recorded in our brain by the science communication, conspiracy theories, news, and persuasion. That is our persuasion. The emotional brain and the circuit of the limbic system. I'll give an example of a small video how quick the action will be when you got fear or threatened. So I showed the video that you can register in the brain how fast the ignition will be. We observe the above circuit in so-called COVID-19 cases. A schematic view of major brain circuits involved in the fear and anxiety. External from the external auditory and visual olfactory and somatosensory stimuli are relayed by the thalamus to the amygdala and cortex. The basolateral complex of the amygdala is the input of the system, which is also receives the contextual information from the hippocampus formation. After intra-amygdala processing of the stimuli, the central nucleus of the amygdala on the output activates the locus coeruleus. In stress, the locus coeruleus is activated by stress and will respond by increasing the norepinephrine secretion. Norepinephrine is a naturally occurring chemical in the body that acts as a both stress hormone and neurotransmitter. It's released into the blood as a stress hormone when the brain perceives that a stressful event has occurred. As part of the body's response to the stress, norepinephrine affects the way the brain pays attention and responds to the events. It can also do the following things: increase the heart rate, trigger the release of glucose into the blood, increase the blood flow to the muscles to escape from the threat. Central and peripheral noradrenaline systems via the corticotropin releasing factor neurons, the hypothalamus paraventricular nucleus, and the lateral hypothalamus. The bed nucleus of the stria terminalis, part of the extended amygdala, is also control central for the neuroendocrine system by integrating information originating from both the hippocampus and amygdala. In addition, the central nucleus of the amygdala directly activates various midbrain regions nuclei responsible for different aspects of the fear anxiety response. Freezing or escaping at para-aqueductal grade. Increased respiratory rate at parabrachial nucleus. Startle cause to feel sudden shock or alarm called a reticulopontine nucleus of the reticular formation, and the dorsal motor nucleus of the vagus in the medulla, which together with the lateral hypothalamus is responsible for increase in heart rate, blood pressure associated with the emotional events. The prefrontal cortex processes more elaborate cognitive information. It modulates the physiological neuroendocrine and behavioral responses via the amygdala, and it is also involved in extinction of the fear and anxiety related conditional responses. Adrenocorticotropin hormone, autonomic nervous system, blood pressure, GABA, glutaaminobutyric acid, glutamate, noradrenaline, or nucleus ambiguous, nucleus tractus solitarius are involved. You can see this diagram It shows the signals, it shows the signals how quickly the person acts. The fear hormones. Adrenal gland is an endocrine gland that produces two fear hormones, adrenaline and cortisol. These hormones are carried in a bloodstream to all parts of your body. Fear hormones are secreted by adrenal gland and endocrine gland located on the top of your kidneys. Adrenaline, cortisol, norepinephrine, the three major stress and fear hormones. Explaining adrenaline. What it does. Commonly known as a fight or flight hormone, it is produced by the adrenal glands after receiving sudden pandemic related messages from the surrounding, like positive test results. Adrenaline, along with norepinephrine, more on that below, is largely responsible for the immediate reactions we feel when stressed. Your heart is pounding, your muscles are tense, you're breathing faster, you may start sweating. That's adrenaline. Along with the increase in the heart rate, adrenaline also gives you a surge of energy which you might need to run away from the dangerous situation of so-called COVID pandemic and also focus on your attention. Norepinephrine. What does norepinephrine do? A hormone similar to the adrenaline released from the adrenal glands and also from the brain. The primary role of norepinephrine, like adrenaline, is arousal. When you are stressed, you become more aware, awake, and focused. You are just generally more responsible of escaping from the so-called positive patients when they sneeze, when they cough. Ignoring them, it also helps to shift blood flow from many areas, from other areas where it might not be so crucial, like the skin, and toward more essential areas to a time, like the muscles, so you can flee from the stressful scene. Cortisol, a steroid hormone commonly known as a stress hormone produced by the adrenal glands. It takes a little more time, more minutes rather than seconds for you to feel the effects of cortisol in the face of stress, because release of this hormone takes a multi-step process involving two additional minor hormones. First, the part of the brain called as amygdala has to recognize a threat of COVID pandemic. It then sends a message to the part of the brain called as hypothalamus, which releases corticotropin releasing hormone. The hormone then tells the pituitary gland to release ACTH, adrenocorticotropin hormone, which tells the adrenal glands to produce a cortisol. In survival mode, the optimal amounts of cortisol can be life saving. It also helps to maintain fluid balance and blood pressure while regulating some of the body functions that aren't crucial in the moment, like reproductive drive, immunity, digestion, and growth. But when you stew on the problem, like so-called COVID positive diagnosis, the body continuously releases the cortisol, and chronic elevated levels of the cortisol can lead to serious issues. Too much cortisol can suppress the immune system, increase blood pressure and sugar. We all notice such symptoms in the COVID hospitalized patients. During the pandemic situation, Dr. V.S. Reddy sir educated all the staff about fourth biological law, that virus doesn't kill. He enlightened everyone with the knowledge of Dr. Hammer theory and made them feel fearless. They all provided service to the patients, became the reason of the building confidence levels in the patients. Practically, they have seen all the staff not wearing masks, not using sanitizers, not getting panic. The confidence is given by Dr. V.S. Reddy sir on the basis of Hammer theory. What are the happy hormones in the body? For example, serotonin, oxytocin, endorphins, dopamine. Dopamine, it is also known as a feel-good hormone. Dopamine is a hormone and a neurotransmitter that's an important part of your brain's reward system. We observed after the diagnosis of so-called COVID patients became sad and happy hormones levels drastically falls down. Dopamine happy hormone, when it decreases, The peripheral dopamine receptors mediate changes in the blood flow, glomerular filtration rate, sodium excretion, and catecholamines release associated with the fewer adverse effects will be developed. Some signs and symptoms of the conditions related to the dopamine deficiency includes muscle cramps, tremors, spasms of alveoli, aches and pains, stiffness in the muscles, difficulty in breathing, etc. Coming to our Dr. Hammer's German New Medicine theory. The five biological laws of the nature, each significant biological special program is formed by a biological conflict shock experience of so-called COVID registered on the brain levels. Three levels, psych, brain, and organ. The biological program of the nature is to improve the function of the organ and make the individual become better to manage and eventually resolve the conflict. I'm sure that everyone here is well aware of five biological laws of our great master Dr. Verghese, sir, who in detail explain in different seminars and in his audio clips as well. I think that there is no need to explain in detail about five biological laws, but I would like to quote a few points in relation to the virus. In conflict active phase, generally, when a DHS occurs, stable circadian rhythm instantly interrupts and the autonomic nervous system switches to the lasting sympathcotonia. Tension and thoughts are constantly revolving around the conflict. The psyche is a compulsive thinking, more nervous, restlessness, faster breathing, heartbeat, increased blood pressure, slow digestion, frequent urination, poor appetite, poor sleep, feeling wound up even in night, the extra waking hours, and total focus on the conflict. The psyche, the brain, and the corresponding organ are three levels, one unified organism that always work in the synchronicity, said by Dr. Hammer. In the organ level, the conflict related organ responds to the physical changes that serve the biological purpose to improve the function of the organ so that the individual can deal with the conflict. According to the fourth biological law, microbes don't cause diseases but play important role during the healing phase. Microbes are endemic. They live in the harmony with all organisms of the ecological milieu in which they have developed over the million of years. Diseases are not contagious. Based on two-phase pattern of every special biological significant program, infections cannot be transmitted to another person since the symptoms discharge inflammation, fever are already healing symptoms. Moreover, DHS with activates biological special program is highly individual conflict experience. If two or more people happen to have the same symptoms, like the COVID pandemic situation, this means that all of them are in the healing phase of the same type of the conflict. Nowadays, such collective conflict shocks are easily evoked through frightening media reports, threats of so-called COVID deadly virus. Every news channel used to propagate about the coronavirus. The diagram shows the classification of the microbes in relation to three embryonic germ layers and the areas of the brain from where the microbial activity is controlled. Microbes work in a well-planned manner. In normotonia and in the conflict active phase, microbes are in the dormant state. But as soon as the conflict is resolved, they start work assigned to them. In line with evolutionary reasoning, viruses should be theoretically assist the reconstructions of organs, tissues derived from the ectoderm controlled from the cerebral cortex. This is the cerebral cortex and the organs derived from the cerebral germ layer ectoderm are being in the healing phase by the virus. Cerebral cortex controls the outer germ layer of the ectoderm. Nerve conduction from the brain to the organ crossed. Consider the handedness of the right or left, social territorial separation or motor conflicts, fear of the rear or front attack. Not being able to get rid of something, not being able to grasp something, not being able to make progress with something, not being able to digest something, not knowing whether something will be good, not getting something. These are all endodermal derived organs. Development of function of the lung alveoli. The function of the lungs is to deliver oxygen into the body through inhaling and to remove the carbon dioxide through exhaling. Biological conflict linked to the lung alveoli is a death fright conflict because, in biological terms, death panic is equated with not being able to breathe. The control center on the right side of the brainstem relates to not being able to catch the air morsel, that is, not being able to inhale. The control center of the left side of the brainstem relates to not being able to eliminate the air morsel, that is, not being able to exhale, for example, due to the hyperventilation. Generally, in the air which we breathe, the oxygen percentage is 21, and the air which we breathe out consists of 16% of the oxygen by volume. For example, if a car is designed to run with a diesel, and if we are thinking that petrol is more efficient than the diesel, and we use petrol instead of diesel, the car immediately stops malfunctioning and also seizes the engine. In the same manner, in human life, patient also requires normal air and not pure oxygen. Breathing in the high concentrations of the oxygen will lead to damaging of the lungs capacity to the function. So many of the deaths in COVID pandemic during situation have happened due to the ventilation. We noticed death fright conflicts experienced diagnosis shock after the test results based on the medical checkups like RT-PCR test that hits a person like a death sentence, that he is no longer going to live and he got a chronic disease. Statements from the media and government agencies that the disease is inoperable, aggressive, invasive, or remarks like you have no chance to survive and other sentences of this kind can evoke the death panic. Coming to the goblet cells of the lungs. Death fright can be experienced for one's own life or for the life of others, that is, family members, beloved friends, or even pet animals. In healing phase of the goblet cells, another typical healing symptom is night sweats. One of the example of a little boy, he went to the hospital. Their family took him to the hospital due to his condition, and the doctors have told that they should leave the boy in the hospital for about a week by paying 4 lakhs or something around, so that they will treat the patient, treat the boy. And if the boy is not admitted, they said the family members that boy is no longer going to live. He will go to die.
3% ఉండేది 63% ఉంది. బాబు సీరియస్ ఉన్నాడు. మీరు ఫస్ట్ అమృతలో జాయిన్ చేయండి. అమృతలో జాయిన్ చేయండి. టైం ఎక్కువ లేదు, 3 అవర్సే ఉంది. నేను లేట్ 3 అవర్స్ కంటే ఎక్కువ లేట్ చేసి అంటే మాత్రం అబ్బాయి మీకు దక్కడం కష్టం, మీరు అర్థం చేసుకోండి. నేను మాత్రం ఇప్పుడు ఏం గోళీలు రాయా, అక్కడికే మీరు జాయిన్ చేయండి. సార్ మరి బాబు వాళ్ళ అమ్మా నాన్న ఇక్కడ లేరు సార్ హైదరాబాద్ అంటే అది మీ ఛాయిస్, నేను మాత్రం ఏం రాయాను. అక్కడి నుంచి మేము హైదరాబాద్ తల్లిదండ్రుల దగ్గర తీసుకెళ్ళాను. తల్లిదండ్రుల దగ్గర తీసుకుపోతే వాళ్ళు అప్పటికే భయపడుకుంటా ఆల్రెడీ వాళ్ళు ఏ దవాఖాన బాగుంటుంది, కోవిడ్కి ఏ దవాఖాన బాగుంటుంది, వాళ్ళని యశోద పోండి అని చెప్తే యశోద కాడికి పోతుందని వాళ్ళు ఇమ్మీడియట్లీ అడ్మిట్ చేయండి, బాబుని ఇక్కడ మాకు ఇచ్చేయండి, మీరు 5 days తర్వాత రాండి అని. మా పానం అస్సలు ఒప్పుకోలేదు.
5 days ఉంచుకుంటామన్నారా
5
బాబుని?
days ఉంచుకున్నాను. మాకు పిల్లగాని ఏం చేస్తారో, ఎన్ని సూదులు ఇస్తారో, ఏం ఇబ్బంది పెడతారో, మీ కార్డు ఉండి ఇక్కడ ఇచ్చుకోండి, కార్డు ఇచ్చుకొని జాయిన్ చేసుకున్నాను. మాకు వీలు చేస్తారంటే మీ ఇష్టం అని చెప్పి కొన్ని మందులు రాసిచ్చింది. ఆ మందులు పోస్తే ఎటు తగ్గుతలేదు, పెరుగుతలేదు. మా భయం మాకున్నది. మళ్ళీ పోతే నేను చెప్పినాం కదా మీకు మందులు రాస్తే తగ్గదు, మీరు అడ్మిట్ చేస్తేనే తగ్గుతుంది, టెస్ట్లోకి ఒక 5,000 రూపాయలు అవుతాయి, ఫస్ట్ అయితే చెప్పండి, తర్వాత అడ్మిట్ చేసి మాకు ఉపయోగపడి మీరు ఇక్కడ ఉండొద్దు, మేము కోవిడ్ వాళ్ళు చేస్తాం, మేమే చూసుకుంటాం, 5 days తర్వాత మీరు రండి, అప్పటివరకు యూజ్ చేస్తాం. 3% ఉండేది.
Here, the boy has been immediately brought from the hospital to Dr. V.S. Reddy sir. Dr. V.S. Reddy sir have given assurance to the family and treated the boy. Within 2 days or something, the boy has been cured. Bronchial mucosa. The main function of the bronchi and bronchioles is to carry into the lung alveoli where the oxygen, carbon dioxide are exchanged during the respiration. In bronchi, the goblet cells secrete mucus that moistens the respiratory passage and cleans the air entering the lungs. Biological conflict linked to the goblet cells is fear of suffocating, a panic of not getting enough air. The conflict could be experienced, for example, like a medical emergency. Biological conflict linked to the bronchial mucosa is a male territorial fear conflict or a female scare fright conflict. The territorial fear conflict refers to a threat to the territory or a fear of within the territory, at home, at work, at school or playground, in kindergarten or daycare, in a senior's home, in the hospital or in the village, city, country where one lives, and to the fear regarding one's own safety as well as the safety of his pack or his her pack. An acute medical condition, a frightening diagnosis or a prognosis, scary medical procedures or hospitalization are a few examples of a, of what can trigger the conflict. In addition, an adult's panic can also create a territorial fear in child. A fear of losing a partner who secures a home or when a loved one is seriously ill, hospitalized, or diagnosed of a fatal disease. The territorial fear can be shared by people of large areas, for example, during the natural disaster, during war times, or through scarce pandemic fear of so called COVID by the media. You can see the newspaper saying hospitals on high alert for deadly COVID coronavirus.
ఇమ్మడి సరోజన టెస్ట్ రిజల్ట్ అప్డేట్ యాజ్ ఏ పాజిటివ్ ఫర్ శాంపుల్ నెంబర్ సో అండ్ సో.
Positive patient with Dr. V.S. Reddy. P.S. Ramesh, additional P.S. to Elabeli Dayakar.
ఎట్లుందమ్మా అప్పటికి విమానం ఎంత అంతే ఉందా? ఎంత తేడా వచ్చింది మన మంది 5-10 నిమిషాలకు? కొంచెం నిమ్మలం వచ్చింది, ధైర్యం వచ్చింది. కూర్చో ఇక్కడ.
హాస్పిటల్
This is one of the example of a patient which she came through trembling and shivering with the panic situation. Sir has given assurance and also he was talking in the last that how are you feeling? And she's saying that I'm fine. Conventional medicine claims that coronavirus variants such as COVID-19, SARS-CoV-2, Omicron, Delta, Alpha variants causing the death. Threats of a global pandemic can trigger the territorial fear and existence conflicts among the population. Death fright conflict involving the lungs. Scare fright conflicts resulting in the respiratory symptoms such as bronchitis and pneumonia. Bronchial muscles function. It has a vital function of providing the airflow to and from the lungs for the respiration. The biological conflict linked to the trachea is not getting enough air. During the first part of the healing phase, the tissue loss is replenished through the cell proliferation. If the lower section of the trachea is affected, this causes pain behind the sternum due to the swelling and breathing difficulties. With water retention syndrome, the swelling could lead to the airway obstruction. With an inflammation, the condition called tracheitis, typically accompanied by the fever. Biological conflict linked to the bronchial muscles is the same as the bronchial mucosa, territorial fear conflict or the scare fright conflict. The distinguishing aspect of the conflict related to the muscles tissue is additional distress of not being able to escape from the situation, not being able to react, feeling rooted and to the ground and petrified or feeling stuck. Many kids and children felt stuck feeling when their parents, out of fear, didn't allow the children outside to play with their friends and go to the school or go to the playground, etc. During the conflict active phase, It causes the breath difficulties, explicitly. Difficulties inhaling and exhaling is extended because of the reduced function of the bronchial muscles that control the inhaling. Other example of a patient.
ఫ్రీ అయిపోయిన మొత్తం. ధైర్యం పెద్ద మనిషి నువ్వు. ఓకేనా? ధైర్యం వచ్చింది. ఒక 2 నిమిషాలు తేడా వచ్చేసింది. ఓకే రైట్.
He is being so much thankful to Sir, and Sir will say that Dr. Hammer is very great that he have given us with the enormous knowledge of being fearless in life. Biological conflict linked to the pleura is an attack conflict, specifically an attack against the chest. An attack against the chest, however, like a surgery in the chest area, thoracoscopies, exploratory lung punctures with an insertion of a needle into the lung, tubes placed in the chest to drain fluids, or implantation of the catheters or ports into a vein of chest for long-term intravenous treatment, including the chemo treatments, also trigger the attack conflicts. In the healing phase, we find like symptoms of chest pain, coughing during the pain during the coughing, breathing difficulties, fever, and night sweats. You all know about the symptoms of the COVID, so-called COVID pandemic situation. Everything is related to the panic and threatened situation. Diaphragm linked is the biological conflict linked to the diaphragm is not being able to breathe sufficiently or deeply enough. This is a physiology explaining about the muscles of the respiratory system. During so-called COVID pandemic situation, there is not only death threat conflict people went through, but also many other conflicts like abandonment conflict, refugee conflict, existence conflict, separation conflict, feeling stuck conflict, starvation conflict, because many of them didn't have food to eat, resistance conflict, because many people couldn't resist about the financial losses of losing job and couldn't provide food for the family. Nest worry conflict felt by the mothers or fathers and the people who carry out their families. Morsel conflicts, not being able to digest the information that their loved ones are very far away from them and they couldn't meet them. Loss conflicts, many people's relatives have died due to the COVID pandemic situation. Many of the peoples have become victims of the so-called COVID pandemic situation. Learning GNM enlightens us into the fortunate position to welcome the fear-free life. The reason why I choose the COVID pandemic 19 situation is that in case if in future also if somebody is threatening us about the virus or bacteria or fungi, we should be aware that they don't cause death. Instead of this, instead of them, only our fear causes death. Thanking one and all. This is Dr. Shauri Venkateshwarlu signing off.